Good afternoon. I'm very conversational. I'm Southern, y'all, so y'all know I like to talk. But I want this to be like us talking with stuff, and this is a lot of stuff, and some of it is heavy because it's students' experiences. And this whole study, this is technically a re-study, has been driven by students. It came from students, and I just worked, with students and for students, and listened, and I'm like, okay, how do we document this, and how do we show this is the depth of your experience? So for those of you that don't know, I work at University Health Services. I've been there almost 5.5 years. I do alcohol and other drug work. Substance abuse specialist is my title, but I do a lot with alcohol. How a lot of undergraduate students know me is the lady that runs the required alcohol course. Hi, all. But so I end up doing a lot of data, but then how do we help our students? Because what we see with alcohol use on this campus is very different than other campuses. And then how it impacts our students, and specifically our students of color, and I'm going to get into all of that. So we will have some discussion and take in everything because it is a lot. So let's get started with starting with the alcohol culture. So for those of you that did not know, Wisconsin is now the number 2. It was the number 1, but it switches between us and North Dakota state for binge drinking for 18 to 44-year-olds. And it's only by 0.5 of the point that North Dakota is beating us this time. So what does that mean? 18 to 44-year-olds is not just our college student population. It's the whole state of Wisconsin, and binge drinking is, in most cases, having 5 or more drinks in a 2-week period, in a sitting in a 2-week period of time, normally within 2 hours, depending on which variation that you look at. So when we start off looking at the state, it's a big drinking culture before we even get to the university. So then we start looking at the state alcohol outlet density. The one with the red dots are the bars, the yellow dots are the grocery stores. You notice some things. Then on the right side, or on your right, the one that just has all of the bars and taverns, and like that little like 0 or dot like that is around Madison, that's a lake. So when we start looking into things like thinking about, all right, the alcohol culture, we got a lot of bars here comparatively to everybody else. Then let's look at the university, right? When we look at our undergraduate students, 50.3% of them drink at high risk. And some of y'all are like, well, yeah. And so what about the other Wisconsin schools? They've got to be that high too. Nope, they're at like 35%. The national is at 36%. We're higher. Then we look about the bars that are around the 3-mile radius of campus. And again, part of that radius is a lake. There are 376 places that students can buy or purchase alcohol that is not on campus. And then, now this is 2 falls ago, but in the fall of 2007, because I did a detox study with our police department, we looked at those students who were transported to the hospital or a detox facilitation place, which Wisconsin is very different in having a detoxification center. It's a 29-bed facility for a student. It's for everyone in the community. It's not that we run it, but that's where students are transported, unless they're basically near death, which would be the hospital. But their average BAC of someone who was transported was 0.22. Some of y'all are like, but what does that really mean? 0.08 is the legal drinking limit. So drinking and driving, that's what you normally hear. 0.22 is 3 times that almost. What we know about our students, and I do the alcohol U data, is we already attract students coming to us drinking at higher rates than everywhere else. And I'll show you that in a little bit. So again, looking at how we compare, we have compared in the past, we're higher than everybody else. We include graduate students, that brings us down to 42%, but we're still higher than everybody else. So then y'all are like, oh, it's just the first year students. No. With our undergraduate students, what we see is that whatever pattern they develop their first year, they increase and continue on their 2nd, 3rd, and 4th year, with it dropping down their 5th year. And again, our graduate students are lower when we look at just high risk drinking. So I know this is like a really, really colorful graph, but I've got a simpler version of the next one, but this is looking at our past college students who took alcohol at UU, right? And these are the first year students. So this one we can say is the first year students, but how we compare to everybody else. So just looking at the 3 bars, which they're the different drinker types, you see there's a difference between Wisconsin, the other schools that take alcohol at UU, which are Minnesota and Michigan, the other Big Ten schools, which there are only 6 of, or the large public national, which there are 52 schools, or just the national, which there are over 500 schools. Our students are drinking and being in this environment at higher rates than everywhere else. So some of the other things that are specifically unique to Wisconsin, we have some of the lowest alcohol taxes in the nation. The beer tax, which is 0.04 cents, has not changed since 1969. Alcohol is really cheap, so it's affordable, available, all of those environmental strategies that you hear on the news. And then there's some unique laws to Wisconsin that are different than other places, like we do not have a public intox law. La Crosse does, but it's by municipality. We do not have that. Sober server is not a requirement in some of the taverns. The commercials always have it. And then there's also the parent law, which is supposed to stop at 18, but doesn't really, where it's not just that, like in other states, you can drink in the privacy of your own home with your parent, but Wisconsin takes it a couple steps further, where you can drink with your parent and also order in a tavern, out in public. And so that becomes a different set of circumstances that we see with our students. So talking a little bit about campus racial climate, and just talking like really about the last 4 years of things that have happened in our environment. When I did Color of Drinking 1, we did in 2015, that happened 2 weeks after Tony Robinson, which was a shooting in the community for those of you that don't know. And then there was the spring of 2016 where there were 55 different hate bias incidents and like the birth of the real UW. And then there's been the lynching incident, the Indigenous Peoples Day, destroying of the rock. There have been lots of different racial incidents still through time, and that's impacted our campus culture and climate of what our students have been experiencing. And then again, I bring attention to the real UW because we also did an analysis, because I have my students do different things, of the tweets, the yik-yaks, the Facebooks that were coming in, and like looking at what were students saying. And what we saw when we analyzed them was that 1 out of every 5 things that students reported, alcohol is involved as an aggressor. So, now I'm going to let y'all talk a little bit, because I've talked at you for a little bit. And it's on your worksheet too. What are your initial thoughts, and what is your experience with the Wisconsin drinking culture and alcohol culture?
It's a social media.
Is this like open floor?
Open floor.
Open floor. I'll go.
Go for it.
All right. Hi everyone. I'm Amy. I'm a graduate student in the English department here, and I also teach freshmen primarily, sometimes sophomores, and I do a lot of work on campus for racial justice as well as LGBT and disability rights. So I'm pretty aware of these issues, but not to the extent you're bringing up now. As a graduate student, I feel like I've been extremely pressured by my peers to drink. It's not something I did a lot in my college years, but since coming here, it's really been forced upon me, and I've seen a lot of my colleagues turn to alcohol and other drugs out of stress and inability to process the high levels of graduate work. In my own teaching, what has amazed me most moving here from Boston is how normalized drinking is in family settings, and how so often they just say, this is the Midwest, welcome here. This is what we do. And at first I was kind of like, oh, maybe it's just different, until I started getting really close with my students, and they started telling me things about how it affects their work and how it affects their depression in ways that they cannot communicate to their peers. So I'm really grateful for this forum and your work.
Thank you.
Yeah, I was interested in the maps. There seems to be some correlation between how cold it gets in the winter and the level of drinking, which isn't really that much of a surprise, because it's also a problem in Russia and Scandinavia. And then, according to your maps, it's also a problem in Alaska and many of the northern states.
Yes. Yes, sir.
Yeah, not surprising at all, right? I mean, I've worked with Native American students for a long time, and we had a couple Native American students who were attacked on and around State Street around kind of midnight-ish. And so, for most of us, staff and faculty colored, we just try to avoid Langdon Street and State Street anytime after 11 because we're almost guaranteed being harassed. Something's going to happen. So it's just a wise choice to avoid Langdon and State Street Thursday, Friday, Saturday nights, unless you are going to have to deal with something. But one of the things that strikes me is about the beer lobby and Wisconsin drinking culture as a state. As you said, we're the second binge drinking leading state in the nation. And the thing that I find a little disheartening about our own community is that we kind of set this expectation for our own students in some ways with home football games, where suddenly we close down all of our parking lots and model drinking for our entire community, saying this is what we do. We start drinking at 8 a.m. That's who we are. So I think part of the issue is our own culture as an institution, that we say that it's okay to get wild in this way, and we model it for our students explicitly every home football game.
Yeah, I would jump in. So I came to Wisconsin from New Mexico, where I always assumed that our drinking culture there was pretty bad because we hear about DWIs and DWIs. So coming here and being introduced to a community where alcohol and drinking is very normalized was very shocking for me. Hearing you're talking about where you can order alcohol with your parent in a restaurant, I thought that was huge. So it is really interesting kind of getting involved in this community and seeing how things are so normalized. And I totally echo what you're saying about the drinking culture related to our athletics. When I was driving that region and seeing people set up on my way there, it's shocking. And so do we really expect students to think that it's not okay accessibly if that's what we're promoting in our community very close to campus?
Thank you all. Anybody else? Yes, ma'am.
I went and visited a campus that my niece was going to, and I just said to her, well, let's go down to your union and have a beer, only to find out that we're one of the few campuses that allows alcohol at our union. And I was surprised.
Yeah, I was going to say, when I was much younger, I lived in the New York area, and there it's rigidly enforced, the minimum age requirement to be in a bar, and whereas here it's virtually a family institution. It's sort of a social center, especially in small towns.
Yes, sir, in the back.
Yeah, so I'm a second-year MBA candidate, and it's super interesting to see my classmates that didn't go to a Big Ten school, didn't go to a school with an ingrained drinking culture, but come to Wisconsin and choose to go to bars that I wouldn't have gone to when I was 21, when I was also here for undergrad, and that these establishments is like, this is the true Wisconsin experience, and you won't get that unless you go to Wando's on a Thursday night or things like that. And how that even carries to people that are of like around 30.
Yeah, being an undergraduate here at UW, definitely I can see how the culture that how people know UW as like this huge drinking school just spreads everywhere. Whenever I go home, there's just always this expectation that I can outdrink everybody because I go to UW. And I was kind of surprised when I was a freshman and I went home and people were just saying, you should be able to outdrink me because you go to Madison. And I mean, even when I was abroad in England where there's this huge drinking culture, people would say, oh, you go to Wisconsin, you should be able to drink as much as we should. So I think that that's kind of becoming, or has been, a huge issue as well.
Yes, sir.
I used to be in the admissions office. I was a recruiter for the school, and I know how difficult it is to get admitted to this university. I think you're looking at that's some of the issues there. Students really jump to a lot of hoops to get in, a lot of stress from parents, and when they're here, I think that is, they get permission to blow off steam at the end of the week. Thursday night, I'm going to have a blast because all week I've had my nose to the grindstone. And a funny story, when I was in the office, I was at the county fair representing the university, and I had a mother come up to me saying, my son just been accepted, and I don't like your drinking culture at your university. She couldn't finish her sentence until her husband walks up, hands her a beer. Now this is 11 o'clock in the morning. And they're both drinking, talking about our drinking culture here. So it's Wisconsin, unfortunately.
And this is the environment which we have our students in that thrive, and there's some things, once I get into the survey data, that become topsy-turvy because of that. So, how we got to the color of drinking survey, like I said earlier, this actually came from students. And it all started with the alcohol EDU data. In 2013 was the first year we did alcohol EDU, and this is one of the charts I showed to ASM. And they were sort of, the chair at the time asked me the question, well, Ms. Washington, you're talking about negative consequences of students and, to all students, but you're talking about their own drinking. What about the negative consequences to students of color who don't drink, like discrimination and harassment? Is there any way to measure that? So at the time, I was just like, oh, you know what? This will just be easy. I'll find a survey question I can ask, and we can get at this issue. Well, so I looked in the research. I had my students look in the research, and there's not a lot on secondhand impacts of alcohol that are not just to the drinker. So I hired a new student, and our goal was, okay, we're just going to do focus groups with different communities of color to sort of see what is the issue, what are we trying to ask and sort of get at. So we ended up starting off with the Mestizas and their Latinx subgroup, and they were like, we ain't got time for no focus group. To which me and my student replied, they're like, well, we'll do a survey. My response was, okay, are y'all going to check your email? Because I know that's a thing. And they were like, we will if it's a 10-minute survey. So we spent the rest of the fall developing it, and we went through IRB, and it was certified as not research. And so we sent it out, and it was just to students of color. It was a 10-minute survey, 24 questions. I like qual. The Survey Center doesn't like that. I like qual as much as I do, but I feel like qual tells you a little bit more than quant. And so students were able to tell what their experiences were when we're asking questions, so we sort of started getting at some things. So then fast forward to fall of 2017. I'm in a new year, so it throws me off a little bit. And so we did this again, but we also included a sample of white students. And we incentivized it where every student who participated in the survey, and it was all undergraduate students, mind you, got a $5 Amazon gift card upon completion. Yeah. So to get some compliance, and we did a census with our students of color and a sample of our white students to sort of look at the experiences. And we asked them the same questions, with the exception of the microaggression question was only asked to students of color. So hopping into what the data showed. So this is on one of your first pages in your packet, and it's in the back pages in the back of multiple course, but I always like to ask the question of, how do you describe the alcohol culture? Right? Just straight up, and this is an open-ended question, not me trying to put qualitative anything or quantitative anything in it. How would you describe it? And there were some differences, and there were some things that jumped out as the same. And coding all of these with the help of one of my students. So for students of color, and again, some of these things are the same, some of them, the alcohol culture is prevalent. It's pervasive. It's everywhere. The alcohol culture is how UW-Madison students socialize. And the pressure to participate in the drinking culture is high. When we looked at the white students, the alcohol culture is how UW-Madison socialize. The UW alcohol culture encourages drinking heavily. And participation in the alcohol culture is dependent on who you socialize with. So setting that up as the context for which our students are navigating our campus and their academics. But when we look at our alcohol culture with all of those outside things, how they navigate it differently. And we already know students of color tend to drink less than our white students. Okay, going back. So we asked what we asked in the first one, and the comparison to 2015 is only students of color. But we just asked, like, as baseline, we asked this on lots of surveys. And then within the last 30 days, when you drank, tell me what days did you drink as a baseline. And so the difference between no and I don't drink is no might be I drink, but not in the last 30 days. You asked about I don't drink, or those people that are true abstainers is like I don't drink at all. And so again, you see there's some differences between our students of color and our white students. It stays about the same. And then we start getting into drinking types, since we have all of those listed for you on the pages in the book. But you start seeing there is a leanway where there are some students of color that high risk drink, which is heavy episodic plus problematic, so the red and orange. But there are more white students that fall into those categories when we look at them in our culture and our environment, and getting at the whys. And no, we do not ask this question of what kind of drinker do you think you are? Our students have inverted social norms sometimes where they perceive they drink less than they actually do. And so when we ask them, their answer to that question is, I'm a low risk drinker. Well, how many drinks did you drink? 8. That's not low risk drinking. So we gave them a calendar and had them fill in on what days you were drinking, how much were you drinking, and then classified them based on their answers. For those of you that are like, how do we do this? So when we start looking at drinkers, and I've sort of already said it, students of color had more rates of abstaining and low risk drinker than our students of color. But then when you start looking at flourishing, which we looked at with using the Diner scale, because our Healthy Minds data does this, and it sort of showed the same things, but our white problematic drinkers and our white high-risk drinkers had higher flourishing scores. And some of you are like, what is flourishing, and what does that really mean? Flourishing is just positive well-being. It's not tied to mental health or mental disease. It's just like they have positive well-being and are confident in themselves. So our white high-risk drinkers and problematic drinkers had higher rates of that than comparatively to any other drinker category. And so they feel better about themselves, and they're tending to do better on our campus in other ways. This is also shown in Healthy Minds, so this is not like color drinking didn't just show this and print this out. But the other thing that we saw in Healthy Minds that also becomes correlation, not causation, is that with our high-risk drinkers, they tend to have higher reported GPAs. And it's only by like half a point than our students who don't drink at all. So thinking of how that plays out in different ways, like using the Healthy Minds, like the average of the drinkers, and it didn't matter if they were high or not, was like an A-, versus with the non-drinkers, it was like a B. So again, just like a half a point, but we've seen it in other ways by correlating some of our high-risk drinking groups and looking at their GPAs, and they have higher rates, like some of our Greek students, or some of our high-risk residence halls. Or we did one year with the help of the Dean of Students Office, students who got caught for alcohol violations had a 3.8 GPA on average, compared to everybody else. So, moving on to getting into safety and concerns, and we asked this on the first one, and it was more of a write-in, but this time we just asked. And both sets of students said this at high rates of, are there anywhere on campus or off campus that you avoid specifically due to alcohol? 41% of our students of color and 31% of our white students said yes. And so I asked them, what are these places? The places were exactly the same, just different percentages. Fraternity and sorority housing, Langdon Street, State Street in the bars, or off-campus parties, right? All of them technically not really campus, but what I always point out here is Langdon and State Street run through campus. And so they don't just start at Lake Street, but then also thinking about how students access and safety aspects of things. If someone is studying at Memorial, right, it's the only 24/7 library, where are they gonna have to cross to get home? Because like there's construction, so the buses are different places to go home. And what and who may they encounter if it's a Thursday, Friday, or Saturday night. So then the other question we asked, and this was asked in the campus climate survey, but just we took one of the questions from Color of Drinking 1 and divided it into 3 different things, because we asked about your overall experience in Color of Drinking 1. But we sort of wanted to get at, have you considered leaving? How's this impacting your health? Your sense of belonging on campus. So we asked, have you considered leaving the university? Students of color were more likely than white students. And we asked, what are some of these reasons? And reasons are different. Mental health is number 2 for both groups of students. But what I always like to point out with how we asked the question, and I've got the campus climate survey next to sort of show the difference. was that alcohol is in the top 6 for either group. So then, this is the campus climate survey just for reference of the groups, because I didn't know at the time when I was writing the survey that this question was being asked there. And the reasons, as it is on the campus climate. Some of them are the same, some of them stay about. So then, next we asked about how has it impacted your health, right? Because I work at the health center, you want to know, like, how is the alcohol climate impacting me, sort of being at physical, mental, social well-being. And it looks like percentage-wise, more white students said they were impacted, but when you look at the actual numbers, which are in the table, actually more students of color, but there was a difference in their responses. Oh, going back, sorry. So our students of color talked about mental health issues and safety, such as sexual assault, being fearful of that or leaving their house. Our white students talked about more of the physical, like gaining weight, or the social aspect, like I'm having issues with my friends because of it. So there was a difference in even severity, and you can see by the student responses in the booklet how students sort of define their experiences. So also just to show, when we look at mental health disorders, who is mostly impacted when we start looking. So when we look at depression, and this is from Healthy Minds in 2016, you see that sort of the same groups keep popping up, but Black, Latino, different gender identities, and financially struggling students have higher rates of depression. Same is sort of said for anxiety, which is 16% overall of our population. And then suicidal ideation, more students of color are more likely to endorse that than some of the other groups. And then also talking about safety, when we look at sexual assault on this campus from the AAU survey done in 2015, looking at, all of the different groups, with the exception of one, of different identities, have higher rates of victimization among the women victims. So playing into some of the other cultural factors. So the other thing we asked about was sense of belonging. Like, is alcohol tied to sense of belonging? Is something we wanted to know for our students, because we hear that a lot, like you're sort of told you have to drink to fit in or to drink to belong. And so we asked both groups, and about 46% of them said, yeah, it's sort of part of belonging, regardless of which way the cookie crumbled. And so, but there were some subtle differences. For our students of color, if you don't drink, you don't fit in at UW-Madison. Alcohol can be isolating, or alcohol amplifies racial issues, and that people say things when drunk or otherwise. I know the white student section looks bigger, but there's little nuances here, and it was sort of all about the same number. Alcohol helps you fit in and belong. If you don't drink, you don't belong here. Alcohol helps you meet new people. Drinking alcohol helps me feel like I belong at UW-Madison. And alcohol helps you bond with people socially. So, again, this was asked on the campus climate survey, just differently. For belonging, but 50% of students of color felt like they belonged compared to the 75% of the white students. And then with safe, welcomed, and respected, students of color scored lower than our white students, and excluded was higher, just as baseline points. So, getting into sort of the bigger one was microaggression. So we asked non-color of drinking in 2 ways, and this time we just asked it in 1 way. But this is sort of the definition that we used for microaggressions. And so we asked this, and this is only asked to students of color, and again, these are undergraduate students of color. Have you experienced a microaggression at UW-Madison? Simple. And it stayed about the same, really, 61.7 versus 62. Of students of color saying, yes, I have experienced a microaggression. And so on the last 2 pages in your packet, there is like an array of what they said they experienced. So you can get a sense, and alcohol came up as like the number 3 theme and all of that, but we're like, tell us about all of your experiences, so we had a baseline. And what shocked me most, because people were like, what shocked you the most, was how they experienced the classroom. because I'm not in the classroom realm, but like how they're navigating the classroom and microaggressions they experience there and not feeling welcome in their classrooms. So with the microaggressions question, we also asked, have you witnessed and then have you intervened? And we asked this with both sets of students. So a large have witnessed microaggressions, but intervention is low between both populations. And so again, turning back to the campus climate survey of just experiencing and harassing, witnessing behavior. So then we started looking into the classroom, and this is one of the questions from the original Color of Drinking that we broke up a little bit more, or to get more nuanced. And it sort of shows some of the allowances people make for the alcohol culture in their classroom setting. Scheduling groups around the alcohol drinking holidays. The last one, which is the professors, instead of discussing alcohol, it's like making jokes or inviting them out to drink, is really what's happening there. Or, finding alternative study states because of the noise of the alcohol culture or people causing problems from drinking. Then we also asked about people's personal use. We start looking at their own personal alcohol use and how that's impacting their schoolwork. And, white students drink more, so they tend to experience these a little bit more than our students of color. But being too hungover to attend class, missing class, performing poorly on assignments, those are all a little bit high within our groups. So that's me speaking at you. I threw a lot at you, and you can all digest, but what are your initial thoughts? Yes, sir.
Okay, I'm going to plunge into the ice here, discuss something that's normally considered taboo. But I think there's a elephant in the room, and that's the hookup culture, which I think is interlinked with drinking. I think one feeds upon the other, but people are afraid to discuss that for whatever reason. But I think there's a significant interconnection there.
Yes. We do see with a lot of our sexual assaults that 76% of them alcohol was involved by both. And with how much our students drink, at stop one, because they pregame, we know this, they're drinking, anywhere from 8 to 10 drinks and then going to the next place and making decisions about romantic relationships.
But I'm not talking about assaults necessarily. I'm talking about what is consensual to one extent or the other in sexual activity. That's where the problem is.
Yes. And our students, we do know from our sexual assault data that our students understand consent, but with how our alcohol culture works, sometimes that line gets a little bit blurry because they understand you can't give consent when intoxicated, but if someone is blackout drunk, how do you know that they are? And that plays a lot in our environment.
So part of the hookup, drinking games can be a part of that,
Yes.
At least in my colleague at Nebraska did a qualitative study, observational study of that.
Yes, ma'am.
And then just to elaborate to that, I think what's striking for me is how it's much easier for me to discuss and get through to my students to say alcohol abuse and sexual violence are linked. They accept that, that's okay in their heads. But if I said racial violence and alcohol abuse are linked, that would not be a conversation that would be comfortable, I think, for them. And I'm interested too in how the university as a whole is very much, I think, more supportive of also making that link between alcohol abuse and sexual assault, but I do not see that in the same line with racial violence.
And some of our colleagues, have some of that later are working for students and things when we know. But also part of the thing of when things happen racially, when people are intoxicated, it gets blown away. Oh, but they were drunk.
Right.
It didn't mean it didn't happen.
Alcohol makes you racist.
One thing that I find really sort of stunning is that alcohol use doesn't seem to correlate to poor academic performance. Can you guys speak up?
I'm sorry.
I was just noting that alcohol use doesn't correlate to poor academic performance, and so looking at this list of sort of reported microaggressions from students, it's alcohol use is causing so much pain on our campus in ways that are disproportionately affecting groups of people. But it's we're an educational institution, not just a social one, right? And so, the thing that might get academic policymakers to act, is it happening?
Yeah.
Right? That last piece of data you showed in terms of like the way it affects students' academic performance. Like, they might choose to drink instead of study,
Yeah.
but like the rest of the options like aren't really happening.
Mm-hmm. Yeah.
I think related to that, I mean, we need to be clear that what the high-risk drinking culture is reinforcing certain race and class privilege. So the highest risk drinkers that we're seeing are likely to be white male students who report being from upper income brackets and maybe likely to be in fraternities, or I think the second highest is
Business.
School of Business. So that, I mean, that's connected to the privilege of the academic performance piece too.
I grew up in the state, a small town, won't call it out, and then moved around and have been back here about a year and a half.
Mm-hmm.
I think the culture that's here is a culmination of a lot of cultures from around the state, like you look at those maps. Where I'm from, I'm sorry, they're biased terribly in different areas, sexist, racist, you name it. And a lot of students come from those same areas as I did. We eventually figure it out and get there because we realize the people we've learned from really were isolated. They came from a homogenized, really narrow-minded group, I'm sorry to say. And so as that accumulates here, and you have a majority that has that same likeness where they're coming from and what they've been raised to think that these are our parental guidance, these are our grandparents, these are the people that have learned everything from. They get here, and there's people that have that same thought process. And it just grows on itself. And it's happened, well, my first impression of this, being here was many years ago. It's really kind of just keeps tradition. The tradition stays alive, and there's a sense of pride. Oh, we're number 2 this year. How can North Dakota beat us?
Yeah.
Like, there is a sense of pride, and it's sad. It is really sad.
I'd like to say, this is not a new problem. Right, I've been here 19 years, and it's been the same since I've been here for the entirety of my 19 years. And as our role in, supporting Native American students or in student diversity programs, like I said, it's a little disheartening that, our institutional culture hasn't addressed this in a more profound and direct way, considering, the outcomes we see for various underrepresented groups within our campus. And so I kind of think of like equal educational opportunity for all. If we have this known issue and we're not addressing it in any systemic way, it really begs the question what our values really are as an institution. And I kind of think that in terms of, it's a big business, unfortunately, right? I think a few years ago we were the 4th most profitable athletic enterprise in the United States for higher education. So, we don't really want to interrupt the auxiliary revenue that comes with that type of effort. And so we don't really want to interrupt the culture, really, because it would maybe hurt our bottom line in some way. And so we bemoan the experiences of underrepresented groups and the difficult campus climate that alcohol contributes to, but we really have made no sincere efforts to address the root causes of this behavior in some way. So I think that's a challenge for us. Is like I think about most graduate students of color in the School of Education and undergrad students of color I talk to all have a pretty conflicted relationship with this institution.
Mm-hmm.
Like we don't leave and we're not like joining up for the alumni association right away. And so in my thought is like, how do we get to a place where all of our graduates really look back at this developmental time that they chose for themselves and embrace the institution fully versus having a significant amount of our students leave this institution with a very conflicted relationship with the institution instead of one that's championing the institution. So I kind of think, so it's been the same since I've been here. I'm uncertain it's ever going to be really addressed, but we'll see.
I think it also stems from the structure of higher education in general, of the separation between academic affairs and student affairs. And in my career of some length, there has been a lot more merging and connecting across those two silos, if you. But the reputation of Madison that I always heard was that it was a great place to come, you could get a great education, and you could have a really good time, right?
So I think the academic side of the house, the tenured professor, the ways that academics is measured is, has nothing to do with, student life kinds of things. Who gets tenure, the divisional committees. That it's just not on their radar. And you have in my work with teaching and learning folks across campus, there's a lot of interest in the student experience in the classroom. And someone like Professor Linda Roberts used to do a 100 student first year student class on alcohol, behavior, culture, and science. A real passionate kind of desire to use education to inform incoming students, but like 100 students, and it's not part of the curriculum anymore.
One thing that I forgot to bring up, which I always bring up, a sense of belonging, is something that we see with our students, and sort of what Erin was talking about, of like not identifying with the university. At convocation, the chancellor tells all of our incoming students, "You're Badgers," right? But as time goes on, and we've seen this from students, they don't want to be called Badgers. They would rather be called a UW-Madison student. And it's not necessarily linked to athletics, but it's their identity with the school of, I went here, instead of, I am like bleed red for this university. And so like with sense of belonging, that's among all students, not just one group or the other, but they fall out of like somewhere between when they start of being Badgers, they become UW-Madison student. Yes?
Just to elaborate too on that, I remember a few of my students have said to me like, oh, the football games, the badminton games, this just shows like how strong our community is. Everyone is welcome. Everyone's here, and these are always white students. And I've been to one Badgers game, and this was not my experience in seeing diversity. And then in having those conversations with students, you speak to students of color, and it's like, I'm not going to the Badgers game. Like I wouldn't be caught dead there, and not alone. And they'll say, I can't afford a ticket. But primarily, like the season ticket holders are all white students for the Badger games. But the white students seeing those Badger games instills to them that that is what the community looks like.
A point I'd like to make, it might be of value to also look at the question of illegal substances and abuse. I'm sure that goes hand in hand with drinking, but it would be interesting to see just specifically how much it does.
Well, it's actually really lower. So we know marijuana becomes another thing, and we know like legalization and all that, but about 18% of our students use marijuana, and that's actually been declining for us a little bit. Then you start getting into tobacco. E-cigarettes is on the rise, and we know there are other things in e-cigarettes that people were smoking, but like that's sort of where it is. And then like it falls really low to some of the other ones. The next one, and it becomes like of the people who have the wealth to get it, is cocaine.
Yeah.
And of that, one of the highest risk population, that's only 10%. Well, it's 1% of the regular population. So like drug use among our students, I'm not saying it's not happening, but it's happening at such lower rates, and some of it is tied to alcohol use. Like we know, 82% of the marijuana users are high-risk drinkers. And so sometimes it's a comorbid thing.
So like looking over all of the data in this packet, it's really interesting. I think I was expecting to kind of come into and talk about the intersection of alcohol use disorder and being a person of color on campus, and for some reason, like the more I look at this, it just still feels like two separate data sets, kind of. Like I'm seeing, it looks like belongingness and having a sense of belonging is a problem for students of color, that they're experiencing that at a lower rate than white students. And then it seems like, as far as like on page 17, as far as alcohol-related problems, they're actually experiencing that at like a way lower level. Well, sometimes it's hard to tell because there's not like, it's hard to tell whether the difference between the numbers is significant, but in general, it looks like at a lower level, they're experiencing that. And so like, if you had to summarize like, if there's an interaction here, what is it? I'm just, like, I'm puzzled over that, I guess.
Okay, so, and I've got that coming up, but sort of getting at it, for students of color, like alcohol is a problem on this campus regardless of race, but students of color are disproportionately impacted by the secondhand impacts And racism is still alive and well on this campus regardless. But alcohol gives people an excuse to do some really ugly things to our students, and it plays into a sense of belonging, and that you don't belong here if you don't drink. You don't belong here if you're not in the majority. And alcohol acts as a facilitator for all of that. Our students of color are doing the thing, like by our books, by the healthy thing, they're not participating. But they're having more disproportionate impacts to their sense of belonging, and in some cases their mental health and well-being and their safety because of the alcohol culture. And that's impacting them more than our white students, whether it be with sexual assault, whether it be with mental health. And that alcohol plays that big role in that you drink or leave. Someone had that in one of the colored drinkings one. Transfer or transfer, get out, drink or transfer, straight up. And so that I think is the point. And I know it's a little bit more nuanced because it's all that, it's a lot of things to look at. But it all comes back to how are we including and not including in our environment, and that alcohol plays that big role with our students. And it adds as another reason to point out students of color as you are different and you don't belong here.
So Reonda, I see a doctoral dissertation in this. If you had all the resources in the world, where would you take this work?
I think the next group to look at are graduate students because they experience differently than our undergraduates. And this focused a lot on our undergraduates, right? And it sort of also looks at those different dynamics because our graduate students are of age, but alcohol sort of plays in that bartering system with our students. Like in certain majors and things, if you drink, that gets you access to things. If you don't go out with your professors, with graduate students, what could that cost you, especially if it's your dissertating professor? And so that looks different than our undergraduates. So that's probably where I would go next, is looking at our graduate populations versus graduate and professional students, because there are differences. And so looking at how that adds to the campus climate that we build for our students.
They have a lot of student contact as well in the classroom.
Yes.
With undergrads.
Yes.
You just mentioned about graduate students being of age. In terms of your research with the undergraduates, have you seen any data that supports students who want to drink but don't have access because they are under the age? Because from what I gather, it's pretty easy for a student, 18 to 20 to get alcohol.
It is, but what we've been seeing an increase in is fakes. Homeland has contacted the university, if y'all didn't know. But fake IDs, we're seeing an increase in students getting fakes, and again, the students who can afford to get fakes, getting them and getting access, or also Venmoing bouncers at certain places, of how they can get access to alcohol. And a lot of it isn't just underage students, it's oh, you get it from an older person. That's how, it's still there, but a lot of our students are getting it themselves.
The quality of those fakes has gotten much better over the years.
Yes, they scan. And I know PD, for example, has done some liquor store interdictions where they're just sitting outside certain liquor stores and watching people go in and their fakes scanned, and they got alcohol and coming back out and then having to stop them. So looking at the second question, because I know we've been talking about the first one, but how does this impact the work that you do on campus?
Well, I know when I was going to school, it was a long time ago, this was when every bar had to close at 1 a.m., and that was a real disaster. It's much more of a massive drunks all going out at the same time than it is today. So I just tried as much as possible to avoid bar time, which was 1 a.m. at that time.
Mm-hmm. Yes, sir.
I think educating, everybody in this room has learned something from you today, learning from your work and the students that participated. I think it's good for students to know that this exists. Every student should hear this and see this so they're aware. I think that's the start of processing it and saying everybody wants to do better. I think a lot of people do, so that's how it'll affect my work. It's being more aware, asking more questions.
Yes, sir.
I work with Gary and others here at WISCAPE. Part of our job is to take research findings and education findings, not necessarily to shame administrators, but to shame administrators. And to ask the question of, okay, one, are you aware of this? Number two, what are you doing about it? Three, are you doing continuous evaluation? So my point is, we got survey results, this is wonderful, thank you very much, this is great. But what are folks doing in academic affairs? What are people doing in student affairs? What are people doing in the student union? You know, the vice chancellor oversees, and alcohol is the #1 revenue generator for the union.
70%.
Student unions. So Aaron just talked about athletics. We do have registered student organization policies and procedures that we could put in about fraternities and sororities who want to be registered student organization and want to use university facilities. Do you put anything in that language about alcohol use in your facility?
Yeah.
If so, you cannot be an RSO, you cannot. So that's my point, is to what degree now, so what? I don't mean that negatively, it's a very positive statement.
Well, like, and some people have done things, and like for like the registered student orgs, including the Greek organizations, there is a set policy about alcohol use and the third-party vendors and the things that you're supposed to put into place. There are some groups and schools that get around those. Just putting that out there, honestly. And there are some things that some campus has done that's like too broad of an issue in some cases. And what I've been working with a lot of like different organizations or like different units on campus about, because a lot of what our students really want is the base need, and sort of what she was bringing up is to be able to connect and belong. Can we foster that where alcohol is not present? And the classroom should be the #1 place that should be fostered. And so are there ways that we can help students connect and belong or find people within the classroom or within our majors that is not, you know, alcohol leaving you alone to make your friends? Because move-in exactly this year was a week early, and so students had a week of really like there was some structured things. I'm not saying there's not, because I know Carol's looking at me like there was stuff that was structured, but they had a lot of free time to make their friends and before classes started. Yes.
And I would say in my time here, the development of first-year interest groups, you know, big linked, you know, the small cohort of 20 students with 3 different classes. That maybe isn't for everybody, but it is potentially a way to find your little family and have a meaningful relationship with at least 3 adults on campus. And then the growth of the residential learning communities, you know, all of those have come until these high-impact educational practices are, I think, fundamentally, they're about trying to find a sense of community, and the pipeline programs is the same thing.
And we know the learning communities is protected against alcohol, but then we'll do up and down in a little bit. We'll see. So that has the biggest protective factor against high-risk alcohol use is being in a learning community, but that's living and working together. All right, so wrapping up a little bit. So there have been some campus units that have done some things, and again, we can't take all of these issues, and it's like there's so much, and no one can address everything. But like PD were the first ones, because I went and shared this data with them. That's gonna fall. I went and shared this data with PD, and it's like, well, they're showing the places that are not on campus as where students are saying they don't feel safe. And PD sort of was like, okay, we will work with MPD, and for the first 45 days, which is a big campus initiative where we try and work on things in the first 45 days, they're like, we will have a presence on Langdon Street. And they did this past fall. There were some goods and some bads with that, but because they saw that students are reporting they're not feeling safe, can we try and have more of a presence? Because, you know, we're just, as one way they did that. The Red Gym, the full Red Gym, hosted an alcohol-free event at the end of Welcome Week for students following this data, and it was this past fall, which is, you know, a big event. Like housing has lots of alcohol-free events all the time, but this was open to all students at the Red Gym, and it was a lock-in, and it was like a big alcohol-free event because some things in the union are not technically alcohol-free because people can walk in with alcohol. in the union, but this was one of those things to help like that connectedness and belonging and helping students meet. Housing did change some policies and work on some things. I know she's looking at me, on how do we address like when we see it. When we see racism tied to alcohol use, how are we holding our students accountable? And housing has done some things to revamp their sanctioning process. And then the Center for Leadership and Involvement asked the fraternities and sororities not to load their buses in front of the red gym. You know, like, what does that really mean? So fraternities and sororities are our highest risk drinking group, and so before events that are supposed to be sanctioned, they would have unsanctioned pre-games, and people would get drunk and show up and then load the buses in front of the red gym and possibly cause issues inside of the red gym. So the Center for Leadership and Involvement, which is where fraternity and sorority life is under, asked them, like basically told them they're not allowed to load their buses in front of the red gym.
This is before games?
This is before any event, not just games. And this is any social event which they have to have registered. So, summarizing all of this, I'll be here, or you guys can find me. You all can find me. So, alcohol here is correlated for our majority students with academic and social success. In some ways, like, and I've said this in my epidemiologist who I worked with, and she's on this, you know, for our majority students, alcohol is a protective factor, which that's like, ooh, that works differently. It makes you have to think differently about how do we address alcohol. And so thinking, again, as we are a majority school, like if we were to reduce their drinking, is that going to cause harm? Is the other question I have to ask. And you're like, that's not the right question to be asking. But it's one of the ones I have to ask. For our students of color, a lot of things are impacted with the alcohol culture. Not that all of these things are not already going on, but like sense of belonging and racism and not feeling safe and thinking about leaving. Especially like as Erin mentioned earlier, yeah, a lot of people of color don't walk on Lincoln Street at night, like straight up. And then high risk drinking is how our students connect. That's basically high risk drinking equals alcohol, equals connecting and belonging in our environment. Not just drinking itself, it's that extreme high risk drinking. And that's how you're drinking to make friends, and again, the social interactions and choices students are making. And that's what's promoted, especially work hard, play hard among our students. So, this is a different thing. That is it for me. And if you have any other questions, thoughts, or reactions, or anything, I'm here. And I know some of you might have to go, so. Yes, Carol.
You were mentioning the move-in date. That was actually dictated to us because athletics wanted to host a football game.
Yes.
The whole campus had to accommodate the athletics department. Just like that.
Yes, that's the second year that happened.
Yes.
But that allows students to be on campus. Next year, it's looking like it, fingers are crossed, that the student movement will be after the game. But we had Friday games the past 2 years for those of y'all like we had 2 Friday home games, so that impacts moving of our first year students. Hippie Christmas already happened.
Yeah, when I came to Wisconsin, it was shocking. I'd gone to a university in the West Coast that didn't have drinking as such a central way of campus life, and so it was really surprising. When I came here to see how it functioned here. But really, it is the state culture, and I think we've talked about it earlier. And it's most for me emblematic in like driving while intoxicated, the OWIs in the state, where the first one is like, oh you silly you. I mean, it's not really taken that seriously by our own laws and safety for all of our citizens, right? So I kind of think of how we kind of set the tone. Consider it extraordinary dangerous activity. You go to jail in Finland or something for your first offense, but here in the United States, it's just kind of wagging a finger at you. And so it's really interesting to see that. And I would hope that we as an institution, knowing kind of the negative outcomes for our student body, and that we maybe take our policies to a different place. Instead of just being wagging a finger at you, like, oh, you and your first infraction, that it would have more meaning for the students of why this is against the values of how we operate as an educational institution. We do have the power to kind of set the tone based on basically disciplinary kind of rules around these infractions, as compared to the state where we minimize kind of OWIs and things to a degree that other states don't minimize to this degree.
Well, I think Wisconsin's actually unique there, that the first OWI is not considered a crime, it's just a citation violation.
Well, the OWIs here are misdemeanors, and I know the law is changing, but it was like up to your 5th one. They don't take your license. In other states, because I'm from a liquor control state, Southern girl, you get one and you're done. Like, it's a felony. One DUI, and that's like a lot of other states too. You get one and you're done, and you can't get access to certain jobs.
But then you can't drive to the tavern, right? That's part of the power of the tavern.
Yes.
I'm wondering about, you mentioned this about the correlation, you're looking at grades, what students and grades. Okay.
Yeah.
Say, actually, could they have had a higher GPA if they would not have consumed so much? I'm not saying always since I might be here, so, but you get the point. I would separate the social aspect from the academic outcomes.
That's a thought. Yes, ma'am.
Are there other universities that are kind of analogous to our size and seeing the same trend? Like, is this unique to Big Ten schools, or is it, like, if you go to a small private school, like, would you kind of see the same thing? Or?
Well, like, we're the only place doing this right now because, again, came out of students and finding nothing. So I don't know how it would look at our other, areas or other Big Ten schools. But we are, like, a lot unique in some other ways, like the wealth of our students. We're the wealthiest of the Big Ten. The average median income of the UW-Madison student is $154,900 of the family income. So, like, we have different things, and, like, the alcohol laws play differently. Like other states, like, nah, they don't have this many alcohol outlet densities, or there's a state-controlled board. In the state of Wisconsin, it's by municipality. So the city of Madison runs how alcohol is run, not the state of Wisconsin, and they only have to report it to one place a year, which is the Board of Revenue. So there are different laws with the other Big Ten institutions, and, like, even some of them don't have the issues to this level with alcohol use. Like, even looking at some of our numbers of who we catch and how many transports. We're transporting, and, like, it's gone down this past year, but anywhere from 100 to 200 students a year. And for some of the other Big Ten schools, they might transport 10 a year. Sometimes, depending on the week and the semester, that might be us in a week. I'm here if you have any questions. Thank you all for coming.